All right, so the radius. The radius is one of two forearm bones. And for the radius, the head is going to be proximal. So we just went over the humerus. And remember, the humerus has, if we go back to it, this nice rounded area that articulates with the head of the radius. So it should have that nice smooth area of the head of the radius with the nice smooth rounded area of the capitulum. So for the radius, the head always has to be proximal. And then the distal end is going to have this pointy end. So if you actually feel on yourself, remember the radius is going to be on the thumb side. So if you feel right here on your own wrist, you should feel a big bump right about here. And that corresponds to this. So this end is always going to be distal. The smooth head is always going to be proximal. All right, so the different structures. You've got, this is your head. Again, that's a nice round smooth thing. On the top of the head, you have, this is called the fovea of the head, and that's the part that's articulating with the capitulum. Now just under the head, you're gonna have a neck. So the neck is this kind of pinched in area right under the smooth head. Just distal to that, you have this bump. So here, if I turn it, you can kind of see how it's a raised area. This is called your radial tuberosity. And this is a very, very important osteological structure for you to understand. So I say that because the tendon of the biceps brachii is going to attach here. And that's going to be really important when you're understanding the function of the biceps brachii. So we'll talk about this when we do the arm muscles, but I'll give you a quick preview now. So the biceps brachii, if you think about, going and doing bicep curls, you know that it's going to flex your elbow. But the cool thing about the biceps brachii is that it only works when your forearms are supinated. And that's why this structure is so important to understand. The radial tuberosity is on the anterior surface of the radius. So if I put this on myself, this bone's a little bit too big for my forearm, but if I put it on myself, the radial tuberosity is facing up. And if I pronate, notice the radial tuberosity is now facing down. So my biceps brachii tendon is not going to be able to properly flex the elbow because its insertion is now facing downwards. So when your when your forearms are facing down or when they're pronated, what's actually flexing at the elbow joint is going to be your brachialis muscle. And so when I say that this structure is important, that's why. The biceps brachii tendon inserts on the radial tuberosity. The radial tuberosity is facing anterior, so when you're pronated, your biceps brachii is not firing as much, at least. It's mainly your brachialis muscle that's going to be doing the elbow flexion. But I digress. All right, moving along distally. So again, we had the head, the neck, the radial tuberosity. Now all of this is the shaft here. And then if you look at this side of the shaft, you have this nice kind of pointy ridge on the shaft. And this is always gonna face medially on the radius. So the radius on your forearm is gonna be the lateral bone, and the interosseous crest here is where the interosseous membrane attaches. So interosseous, because it's in between the two bones. So if your ulna is here and your radius is here, the interosseous membrane is going to be in between the two. So this is going to help you with your orientation of the radius. So the interosseous crest or ridge is always going to be facing medially on the radius. Moving down, at the very distal end, you have a few different structures. So this pointy part is the point that I pointed out, and you can feel on yourself here. It's a big bump. This is called your styloid process. And if you think of like a stylus, you could write with this. That could help you remember it. On the other side, so the styloid process is going to be lateral for the radius. If you go to the medial part here, you're going to see this nice little smooth indentation here. And this is where the radius articulates with the head of the ulna. So this, if you remember that your ulna is your medial bone, this always has to be medial. The styloid process is always going to be lateral. And then if we flip it to look at the posterior part, you're going to have these little bumps here. And these are called your Lister's tubercles or your dorsal tubercles, these little bumps. So that's it for structures on the radius. For siding the radius, Proximal versus distal, remember the head is gonna be proximal, the pointy part or your styloid process is always gonna be distal. And then anterior versus posterior, the radial tuberosity is always gonna be anterior. And if you can remember that your biceps inserts there, that would help. And then the dorsal tubercles, the name tells you that they have to be dorsal or posterior, so that's helpful. So this has to be sitting like this. And so I could sit it like this, or I could sit it like this if we just went off of those. But remember, the styloid process always has to be lateral, and this part is articulating with the ulna, so it has to be facing medial. And then the interosseous membrane is gonna attach here, which is also medial. So this side has to be medial, this side has to be lateral. So it has to sit like this, it has to be a left. If I tried to sit it like this, where the ulna articulates is here, and that's pointing out, so that makes no sense. So this has to be a left. If I take a right, so here's the right, you have proximal versus distal. You have the tuberosity up here is going to be anterior. If we flip it, these are going to be posterior. And then lastly, the styloid process has to be lateral, so this would sit like this on me.